Welcome to this session where a number of colleagues from universities in Europe will present their innovative approaches to introducing planetary health to students and student nurses and midwives. So we start with the University of Plymouth in the UK with Jenny Aronson, who is a lecturer in adult nursing, and Maisie Pennington, a third-year adult nursing student and also winner of the Sustainability Prize. So over to you, Jenny.
Thank you, Janet. So hello, everyone, and welcome to this session. My name is Jenny. I'm a lecturer in nursing at the University of Plymouth, and we'll be talking about sustainability, climate change, and planetary health today. So at the University of Plymouth, we have got a tradition of including these topics within the nursing curriculum at the School of Nursing and Midwifery. So for example, where we do this is that we have a session within the Student Nurses Induction Week. We try to include some material in public health modules and in clinical skills modules. We also talk about procurement, waste management, leadership and management and leadership modules. Some of our mental health students get some eco-psychology sessions. And we also have research modules where we talk about these topics and encourage students to think about sustainability in healthcare. So I wanted to mention some opportunities within our school, what works for us. So what's really important is to have staff on board, obviously, so to make sure that our colleagues understand the relevance of planetary health, sustainability and climate change within nursing and nursing education. And I feel that that's really something that we have now. We have a core group of lecturers who are research active and driving the sustainability agenda within our curriculum. But also I think that's spreading within the team. This relevance is certainly becoming more highlighted within our staff group. Also, what we're trying to do is that we are using a lot of different pedagogical approaches. There's a lot of research to support the inclusion of things like problem-solved pedagogical approaches, or looking at reflective sessions, thinking about what we do in our clinical skills modules, but also what the student nurses do in the clinical placements. So we try to kind of draw on these different approaches within our curriculum. Really important, and I'll speak about this a few times, is leadership. So there's ample research to say that it's important to have leadership in order to be able to drive the sustainability agenda. And that's something that we certainly have at a school level, is support from above to make sure that we do include these topics for our student nurses. But also, in terms of the wider university, the University of Plymouth is a sustainable university in terms of procurement, catering, estates. So we do have that kind of ethos within our university, which is really helpful. As some of you might know, also there's a lot of drivers within the nursing profession. So we have the International Council of Nurses, who were quite early with their position statement on climate change and health. We are also, in terms of our health system, the national health system, we have the carbon net zero agenda. So the NHS has committed to becoming carbon net zero by 2040. We have our Royal College of Nurses, who have published some information on how nurses can drive the Sustainable Development Goals. And we have our professional body, the NMC, the Nursing and Midwifery Council, who published their Environmental Sustainability Plan in 2024. So all of those drivers are really helpful for us, obviously, as lecturers and educators. I think another opportunity, and something that we do quite well within SNAM, is that we have a lot of international collaborations and initiatives. For example, we have worked with colleagues across Europe to implement the nursing school commitment, which means that we have a written agreement from our head of schools to include material on sustainability and planetary health within our curriculum. I think maybe most important, and what's driving us as educators, is that we have a great interest from students. So we can see that the student nurses want this within their education and think that this is relevant to their future as nurses. And again, I've drawn on a study that we did. Janet Richardson was the first author in 2021, where we looked at student nurses from a cohort in 2014 compared to 2019, and we could see statistically significant differences in students' interest between those 5 years. And that's 7 years ago now, so I'm sure we could do another study and see an even more increased interest. At the moment, we are revalidating our curriculum, so we have an opportunity there to include more material on this topic, and I'll speak about that shortly. I wanted to mention some challenges because obviously it's not always easy. I think one difficulty for educators is that we have an overcrowded curriculum. So there's lots of things that we do need to include in our nursing and midwifery curriculum. So it can be difficult to find that space for these topics within the curriculum. We have also traditionally had a lack of direction from our professional bodies. So I mentioned the NMC. There is a sustainability plan now, but we're still seeing that there's nothing within our code of conduct or our professional standards for nurses to say that we need to be sustainable or that we need to promote planetary health. There will be some new documentation coming out from the NMC next year, so we're hoping that this will then be included. But it can be difficult to drive the sustainability agenda without that kind of direction from our professional body. Another challenge is staff. So although staff often feel that this is relevant, they might not have that time, or they might feel overwhelmed with other priorities, and that can be a real challenge. And traditionally, we have had a lack of understanding and support from leadership. It has been a long journey to where we are now. So that was to do with education. I wanted to mention the research as well within SNAM, because we have a very research active members of staff with an interest in sustainability education, waste management, interconnectivity between human and planetary health, student perceptions, and so on. So we have a lot of research that is happening with several recent publications and international, national and local conference presentations, which is really positive. We are currently undertaking an action research project, which is to do with the new curriculum. So we are aiming to embed sustainability education more consistently within the new nursing curriculum. We do have some doctoral research as well, a recently completed PhD, an ongoing PhD, and hopefully a new PhD student starting in September. So there's a real kind of tradition of doctoral research within this field. So looking again at the opportunities in terms of research, again, leadership has been crucial. We see a real interest from above, a recognition that these topics are important, a willingness to support research and to support doctoral students, which is fantastic. We have now a sustainability lead role within SNAM, Dr. Andy Nichols, and he is kind of the lead in terms of both education and the research aspects within our school. So there's time and resources allocated to that particular role. We have a sustainability, health and wellbeing interest group, SHWIG, which I'll mention in the next slide. We got some student support and especially a yearly sustainability prize, which Macy will present in the next couple of slides, which is fantastic. But also we do try to work with our students, both through SHWIG and through our classroom teaching, to ensure that students are involved and engaged and want to contribute. And we also have nice collaboration with other schools within the Faculty of Health, so a community of interest across the faculty. Of course, there's some challenges as well. So traditionally, again, there has been a lack of understanding and support from leadership, which I think that we really have overcome now. There's a real understanding and a real willingness to support us, which is fantastic. But there can still be lack of time for staff to commit. So both in terms of education and research, I think that's a real barrier, trying to kind of fit everything within your workload. And traditionally, there has been some silo working. There still can be. People don't know about each other. You find out about someone within the school or within the faculty or university-wide, and it's all about connecting people to make sure we work towards the same goal. So I wanted to mention SHWIG, which is a Sustainability, Health and Wellbeing Interest Group. So we meet online about 3 times a year. We bring together university staff, but also students, alumni and colleagues from clinical settings to discuss innovation, ideas, research and solutions within the areas of planetary health and sustainable healthcare. We don't meet many times, about 3 times a year, but if you are interested, please email me, because we do have members across the world and we love to hear about your ideas and your practice. So as I mentioned, each year we do invite students across programs and years of study to submit a piece of work relating to sustainability issues in clinical practice, or resource use and innovation within practice or education, or working with nature for health and well-being. And I'm going to hand over to Macy, who was the Sustainability Prize winner in 2025, and she will share her ideas for the Sustainability Prize.
So my concept focused on clinical waste management, which is an issue that is often viewed as an environmental extra, but is actually a fundamental clinical and financial priority. With the NHS generating over 156,000 tonnes of clinical waste each year, I was motivated to look at how we can bridge the gap between national net zero targets and our daily practice in clinical settings. So what I found through my research was that during and after COVID, our reliance on disposables spiked, yet our disposable system remains stagnant. The evidence shows that poor waste management isn't just an eco issue, it increases infection risks and patient harm. So my proposed resolutions focused on a dual approach. We need the hard infrastructure for better recycling and reusable equipment, but we also need the soft system of staff education to ensure that all staff understand that how we open, use and segregate waste is a vital part of safe care and delivery. So my concept won the Schwig Sustainability Prize, which was a turning point for me in my practice. It validated that frontline nursing insights are essential for system-wide change. This achievement has brought some amazing opportunities from presenting at the University Swig event last year to the amazing opportunity of speaking with you all today. More importantly, it has fundamentally changed how I approach my role as a soon-to-be registered nurse. I'm more mindful about what waste I'm generating and the impact this has had on my environment and my patients. I no longer see sustainability as something separate from my everyday responsibility. It is my everyday responsibility, and I see it as a clinical priority equal to patient safety. Going forward, I'm committed to, in the words of Florence Nightingale, taking the power that we have to model sustainable care on every shift. I want to continue to advocate for these changes and mentor my peers, ensuring that sustainable healthcare isn't just an idea, but a reality in our everyday practice. Thank you.
Brilliant. Thank you so much, Mason. It's just fantastic to see the impact that this has on students and for students to have the opportunity to present their ideas as well. So that's wonderful. So thank you for sharing that with us, Mason. That's great. So just a quick slide about our future at SNAM. So what's going to happen and where do we see ourselves in terms of planetary health and sustainability? Well, through our Action Research project, we have managed to get sustainability and planetary health as a key theme in the new nursing curriculum. So it's one of the 9 fundamental themes that we're going to build our new curriculum around. And again, I feel that staff has really come on board with this idea and everyone is thinking about how they can include material within their particular modules. I mentioned the sustainability lead role, and that's now an established role within SNAM. So that will ensure that sustainability, climate change, and planetary health are integral to education and research for the foreseeable future. And obviously, we have SHWIG, which is a well-established group, and it continues to bring people together to share ideas, discuss, and inspire each other. So this picture is from our clinical colleague, Kate Tanton, who is a sister at ICU, and she implemented a garden for ICU patients, relatives, and staff. This is obviously during COVID, but for people to enjoy as part of their health and well-being. So she was one of the presenters at one of the SHWIG meetings, so really inspirational. Thank you for listening. We will obviously take questions at the end of the overall sessions, and I just wanted to share my reference list, and that's all from us at the University of Plymouth. Thank you.
Thank you.
Thank you both, and particularly thank you to Maisie for joining. It's amazing work you're doing, really, really well done. So now we'll move on to the team from the University of Jaén in Spain, and we have Professor Carmen Alvarez Nieto, Dr. Isabel Maria Lopez Medina, and PhD student Romina Patricia Olivieri, and we'll start with Carmen, I think. Over to you.
Buenas tardes y gracias por este espacio a la Alianza para la Salud Planetaria y a la Iniciativa Nightingale para la Salud Global. Hoy quiero compartir con ustedes cómo desde la Universidad de Jaén empoderamos a las enfermeras a través de la sostenibilización curricular para la prestación de un cuidado climáticamente inteligente. La integración de la salud planetaria en la formación ya no es una opción, sino un desafío obligatorio. La expectativa global respaldada por el Consejo Internacional de Enfermería es clara. Las enfermeras deben ser agentes de cambio frente al clima, promoviendo sistemas de salud resilientes, educando a las comunidades y liderando la salud sostenible. Sin embargo, la realidad choca con esta expectativa. Existe una falta grave de competencia ambiental de nuestros estudiantes y profesionales que a menudo tienen dificultades para establecer los vínculos entre el uso de los recursos, el cambio climático y la salud. Es por ello que en la formación de los estudiantes universitarios integramos la sostenibilidad de manera transversal, entre otras en las asignaturas Enfermería de la Infancia y la Adolescencia, Enfermería Clínica y Enfermería del Envejecimiento. Nuestra actuación se basa en 3 pilares, que son conseguir despertar y aumentar la concienciación de los estudiantes, proporcionar un entrenamiento específico y empoderarlos para la acción clínica. Solo así lograremos una transformación real y efectiva. Para ello, combinamos el aprendizaje basado en escenarios clínicos e inmersivos, usando los materiales de aprendizaje Nursus, con tecnologías de realidad virtual y aumentada que hacen ese aprendizaje más visual y participativo. Cada año, con cada nueva cohorte de estudiantes que inician el grado, seguimos el mismo procedimiento. Medimos las actitudes en el primer año, antes de cualquier formación, y aplicamos los escenarios en sucesivos cursos, midiendo de nuevo actitudes y concienciación en diferentes ocasiones hasta el final de su estudio en el 4.º año. A modo de ejemplo, en uno de los escenarios, los estudiantes evalúan a un niño asmático expuesto a altos niveles de contaminación ambiental en su hogar y ciudad, aprendiendo a realizar la valoración de la exposición ambiental infantil. Otro escenario aborda un procedimiento de alto impacto ambiental, que sería el sondaje vesical. Los estudiantes analizan el uso excesivo de guantes y gasas, el despilfarro de material estéril sobrante y la importancia del reciclaje de envases y plásticos sin comprometer la prevención de infecciones. Otro escenario se centra en una persona mayor, polimedicada y dependiente, que se enfrenta a una ola de calor extrema, donde los estudiantes deben identificar los signos de deshidratación, los fallos en la termorregulación, comprendiendo cómo las temperaturas extremas aumentan la morbilidad y la mortalidad de este grupo vulnerable. El impacto sobre las actitudes y concienciación de los estudiantes es muy revelador. Mediante el cuestionario SAN2 comprobamos que las actitudes excelentes hacia la sostenibilidad y el cambio climático aumentan significativamente tras la formación. Simultáneamente, una mayor concienciación les hace percibir rápidamente la falta de sostenibilidad en el trabajo diario de los centros sanitarios. Y lo más importante, este cambio es duradero. Formamos a enfermeras con una mentalidad irreversiblemente verde, ya que a lo largo de los 4 años de formación, la mejora significativa en la actitud y la concienciación se mantiene. Sin embargo, el ideal del aula choca con la realidad clínica. Los estudiantes entran en infraestructuras insostenibles, con un uso excesivo e innecesario de material, falta de contenedores de reciclaje, prácticas erróneas de eliminación de contaminantes y una notable ausencia de conciencia ambiental de los profesionales veteranos, sintiéndose sin la autoridad necesaria para cambiar las normas de las instituciones en las que realizan sus prácticas clínicas. Por todo ello, es esencial la adaptación del plan de estudios para que los estudiantes adquieran las competencias ambientales necesarias y asumir roles de liderazgo para el cambio, pero también es importante desarrollar instrumentos validados que midan estas competencias relativas a los efectos sobre la salud en poblaciones vulnerables como pueden ser la infancia, las personas mayores y las embarazadas. Next. En conclusión, nuestro mayor reto no es solo educar, sino empoderar un liderazgo ecoético de los profesionales para cuidar el planeta. Muchas gracias por su atención. A continuación, doy la palabra a mi compañera, la profesora Isabel María López Martínez.
A continuación pasamos a exponer nuestro proyecto titulado Impacto medioambiental de las instituciones hospitalarias y concienciación de los profesionales sanitarios sobre la sostenibilidad ambiental. Soluciones para una atención sanitaria climáticamente inteligente. Se trata de un proyecto realizado en la Universidad de Jaén y que cuenta con la participación de 14 hospitales de diferentes regiones de España, concretamente Jaén, Murcia y Cataluña. Los objetivos generales de este proyecto son, en primer lugar, estimar el impacto ambiental de las instituciones hospitalarias y determinar las actitudes, conocimientos y percepciones del personal sanitario sobre el impacto ambiental de su práctica clínica. Partimos de dos hipótesis. La primera, el impacto ambiental de la atención hospitalaria puede ser reducido sin disminuir la calidad de la atención sanitaria. Y en segundo lugar, hay una relación entre las actitudes y los conocimientos ambientales de los profesionales sanitarios y el impacto ambiental de los hospitales. Nos planteamos varios objetivos específicos, destacando la medición de la huella de carbono de cada hospital, la valoración de actitudes y comportamientos ambientales de los profesionales, la identificación de percepciones de los profesionales sanitarios y gestores sobre el impacto de su práctica profesional, así como diseñar una guía de buenas prácticas sobre una atención sanitaria de bajo impacto ambiental. En relación a los objetivos planteados, el proyecto consta de 5 paquetes de trabajo. Primero de ellos, la fase de huella de carbono, seguida de medición de datos cuantitativos con cuestionarios. En tercer lugar, un enfoque cualitativo y la elaboración de una guía de buenas prácticas con la difusión de los resultados. Basándonos en la población de referencia, para la parte cuantitativa se ha estimado un tamaño de muestra necesaria de algo más de 350 profesionales en cada región estudiada. Para la fase cualitativa se seguirá un muestreo heterogéneo, planificando 14 grupos focales, 8 grupos con profesionales sanitarios y 6 con gestores. Las variables de estudio son huella de carbono hospitalaria, con variables adicionales para emisiones directas e indirectas, actitud hacia la salud ambiental, medidas con la escala New Ecological Paradigm, y concienciación ambiental, medida con el cuestionario Healthcare Environmental Awareness Tool. En la fase de huella de carbono, los datos serán recogidos por el responsable de la unidad de gestión ambiental de cada hospital en 3 momentos distintos. Para la fase de recogida de datos cuantitativos, contamos con un colaborador en cada hospital y realizaremos análisis bivariante y multivariante con las variables actitudes, conocimientos y prácticas. Y para la fase cualitativa, con los grupos focales, haremos un análisis temático fenomenológico descriptivo. Finalmente, las categorías emergentes del análisis cualitativo serán integradas con los datos cuantitativos en un análisis global integrativo. Este proyecto cuenta actualmente con la aprobación del Comité de Ética de Investigación y con la aprobación de la gerencia de los 14 hospitales. Y nos encontramos en este momento en el proceso de validación de los 2 instrumentos. Entre los resultados esperados destacamos obtener el impacto ambiental de los hospitales estudiados, una guía de buenas prácticas para una atención sanitaria de bajo impacto ambiental, un informe de actitudes y prácticas profesionales relacionadas con el impacto ambiental, los instrumentos validados para la población sanitaria y conseguir que al menos 2 hospitales de los integrantes se unan a la red de hospitales verdes y saludables. Muchas gracias. A continuación doy paso a mi compañera Romina, que nos va a exponer el proceso de validación de los 2 cuestionarios que estamos llevando a cabo en este proyecto.
Estupendo. Bueno, muy buenas tardes a todos. Soy Romina, enfermera y doctoranda, compañera de Isabel y Cristina, y soy parte del proyecto CleanMar Smart Healthcare. A modo de resumen, ¿qué es lo importante? Porque estamos aquí reunidos. Bueno, sabemos que nos enfrentamos a grandes desafíos y hoy en día podemos decir cuánto el sistema de salud contribuye al impacto medioambiental. Como enfermeros y profesionales tenemos un rol y esto nos conlleva a tomar decisiones y responsabilidades. Pensar en alcanzar un sistema de salud sostenible requiere empezar por profesionales, en principio entrenados, capaces, pero sobre todo conscientes. Please, next. Por lo tanto, para alcanzar este sistema de salud sostenible, además de tener los profesionales entrenados y capacitados, necesitamos que sean conscientes. Y en este camino, desde la conciencia hasta la acción, no es tan sencilla ni lineal. Sabemos a través de la psicología y la sociología ambiental que conceptos como el comportamiento proambiental es multifactorial y además está influido por un montón de factores, entre ellos el contexto, que en nuestro caso está altamente protocolarizado. Entonces, ¿qué hicimos nosotros hasta ahora? ¿Cómo nos pusimos en marcha? Please, the next slide. Validamos 2 herramientas. Por un lado, de Healthcare Environmental Awareness Tool, una escala que tiene 3 dimensiones y que mide tanto la conciencia como los comportamientos tanto personales como profesionales. Y para esto fue necesario que nos autorizara Elizabeth Cheng, la creadora del instrumento Nurse Environmental Awareness Tool, estudio que actualmente se encuentra disponible como preprint. Y en segunda instancia validamos la escala New Ecological Paradigm, que tiene 2 dimensiones, 15 ítems en total, y nos permite valorar las creencias ecológicas, es decir, esta cosmovisión ecológica como lo plantean los autores. Relevante en esta etapa, que si no medimos, no vamos a poder cambiar, es decir, si no sabemos dónde estamos, este mapa de situación no vamos a poder planificar hacia dónde y cómo mejorarlo. ¿Qué es lo próximo que vamos a hacer? Los grupos focales de profesionales sanitarios y de gestores sanitarios. Un grupo heterogéneo, como explicó Isabel, y por supuesto vamos a indagar sobre actitudes, conciencias y comportamiento. A destacar en esta etapa, que tiene el mismo peso y relevancia que la fase cuantitativa, que por más de que sepamos que los datos son importantes, si no conocemos el verdadero significado, es decir, si no escuchamos a los que trabajan en el campo, a los enfermeros y compañeros que trabajan en la atención, nunca vamos a poder entender cómo mejorar y cómo conducirnos hasta este sistema de salud sostenible. Por todo esto, gracias, y los invito a que se pongan en acción hacia un mundo responsablemente planetario. Muchísimas gracias por la atención.
Thank you, team. That's amazing to see the links that you're making between education and the research you're doing. So thank you very much. So now we move to the University of Applied Science is in Esslingen, Germany. And we have for the presentation Flavia Nelblatt, a registered nurse and research associate who's currently pursuing a PhD in this area. So over to you, Flavian.
Thank you very much for the kind introduction and for the opportunity to present our project and our research today. I would like to introduce our collaborative project, Sustainable Action in Nursing, Vocational Education, Curricular Integration of Planetary Health and Digital Competence. The name NAHT is actually a German acronym related to Nachhaltigkeit, which means sustainability in English. So it reflects the core idea of our project, which is promoting sustainable action in nursing education. This project is a collaboration between several universities and practice partners. The coordinating institution is Esslingen University, working together with Bielefeld University and Hannover University. Each partner contributes specific expertise, for example, in digitalization, pedagogy, and sustainability in healthcare. In addition, we cooperate with a wide range of healthcare institutions and educational providers to ensure a strong connection between theory and practice. The project ended in March 2026. The main objective of the project was to qualify practical instructors in nursing education. We wanted to enable them to integrate the concept of vocational education for sustainable development into their daily teaching and guidance processes. This means that trainees not only develop professional skills, but also learn how to make responsible decisions with regard to sustainability. To achieve this, we designed and implemented a series of training sessions for practical instructors across different healthcare settings. In total, we conducted more than 60 training sessions, resulting in over 1,000 participations across all modules. Based on our findings, we also developed recommendations for adapting curricula and for further professional development. The central component of our project is the NAHT toolkit. It is based on 3 key sources. First, the value model for planetary health and sustainable nursing by Shaw et al. Second, the Nurses Toolkit. This is an online teaching and learning resource for nursing education. And lastly, it is based on a curricular analysis of the German nursing context. Let me briefly walk you through the structure of the modules. The toolkit consists of several modules addressing different topics such as hygiene, mentoring, resources, extreme heat, and climate-related diseases. The first module is mandatory. Every participant has to take part in this teaching. Modules 2 to 6 can be combined flexibly depending on the participant's needs. The first module focuses on the general role of nurses and their impact on sustainability. In the second module, we address hygiene practices and explore how everyday routines such as glove use can be made more sustainable. The third module encourages nurses to reflect on their own resource consumption and shows how they can integrate sustainability into mentoring processes. In Module 4, the focus is on resource saving practices and possible environmentally friendly alternatives in nursing care. Module 5 deals with the health risk of heat and discusses how nurses can protect both patients and themselves. Finally, Module 6 looks at climate-related diseases and prepares nurses to prevent, recognize, and respond to these challenges. Each module has a duration of 180 minutes. Each module also follows a clear and interactive structure. It includes a video-based scenario from different care settings, such as acute care, outpatient care, and long-term care. This is combined with theoretical input, interactive elements like quizzes, and examples of good practice. Participants are encouraged to reflect on their own actions and to transfer what they have learned into their daily work. For educators, we also provide accompanying materials, including learning objectives and lesson plans. All materials are provided as open educational resources, which means they are freely accessible and can be used, adapted, and shared. The qualification program took place between October 2024 and February 2026. The quantitative data were collected and provided by our project partner at Bielefeld University, in particular by Christina Seidler-Rolf. The data were collected using a modified version of the SANS2 questionnaire. You can see here the measurement of 2 points before the training, T0, and after the training, T1. T0 is before Module 1 and T1 is after Module 1. At T0, participants already showed relatively high awareness for sustainability. However, at T1, we can observe a further increase in agreement. This suggests that the training strengthens both awareness and perceived relevance of sustainability in nursing practice. The qualitative data, which is based on 9 focus groups with a total of 55 practical instructors, provide some deeper insights. Participants report increased confidence, self-efficacy, and willingness to engage with sustainable topics. For example, one participant said that they now feel more confident speaking up about environmental issues. This shows that the project not only provides knowledge, but also empowers participants to take action. Next, I would like to take a closer look at the factors that influence the implementation of sustainability in practical training. We identified both facilitating and hindering factors mentioned by practical instructors. Starting with the facilitating factors, a key aspect is the role model function of the instructor. Practical instructors need to be aware that their own behavior strongly influences trainees. This is also reflected in the quote shown here. Instructors should feel confident in addressing sustainability and be prepared to answer related questions. Another important factor is the integration into existing routines. Sustainability should not be taught as an additional topic, but rather embedded into everyday training situations. Closely related to this is the reflection of one's own actions. By reflecting on and adapting their own practices, instructors can make sustainability visible and relevant in a very practical way. However, several barriers were also identified. One major concern is the risk of overwhelming trainees. This is especially relevant for students in the earlier stages of their training who are still focused on learning basic procedures. In this context, additional sustainability topics may be perceived as too demanding. Another challenge is time and structural constraints in everyday practice. Finally, participants mentioned language and professional requirements. Some instructors are concerned that the complexity of sustainability topics combined with the already high learning demands could make it harder for trainees to keep up. Overall, we can conclude that sustainability is more effective when it is integrated into existing practices and routines rather than being introduced as an additional separate topic. What's particularly interesting is that the practical instructors also shared very concrete ideas for change during the focus groups. First of all, they emphasized the importance of qualifications and training. There was a clear wish for mandatory training formats and for sustainability to be integrated into existing education programs, ideally across all professional groups. Another important point was the need to assign clear responsibilities. Participants suggested having designated sustainability officers or green teams at ward level, and making these roles more visible within the organization. They also mentioned the need for structural changes in everyday practice. This includes, for example, motion sensors for lighting and the use of reusable materials. In addition, participants highlighted the importance of greater transparency. They suggested making resource use more visible, for example, by comparing single-use and reusable products, publishing consumption data, or providing annual reports on savings. Finally, they stressed the importance of participation. This includes involving staff through surveys, idea management systems, and generally creating opportunities for employees to contribute their own ideas. In addition, expert interviews with managers are currently being conducted, and further focus groups with nursing trainees are planned. These additional data sources will help us to better understand how sustainability can be implemented not only on an individual level. Okay, to summarize, practical instructors show a strong interest in sustainability topics, and the project contributes to increased awareness and reflection. It acts as a catalyst for change, especially in how sustainability is perceived and discussed in practice. In the long term, these concepts should be integrated into nursing curricula and become a standard part of training programs. Looking ahead, looking to the future, the project will continue in a second phase. This phase will focus on managers in healthcare organizations because sustainable change also requires support at the organizational level. We will also develop a train-the-trainer concept to enable a wider dissemination of the toolkit and further expand its content. Our overall goal is to contribute to long-term integration of sustainability into nursing education and practice. Thank you very much for your attention.
Thank you, Flavian. It's lovely to see how you're focusing on people in practice as well, not just the nurses in training. I think we have a question that's directed to Jenny. So Jenny, perhaps if you could read the question out and then prepare your response. Thank you.
Yes, thank you. I did type a response, but it's probably easy to talk you through the question and answer. So the question was if I could explain a bit more about my action research interests in Plymouth and possible strategies for applying this type of research for system redesign in clinical and community practice settings. So I assume because it says about action research that that this person was asking about the action research project that we have in relation to the curriculum development, which has been really interesting. So that's an ongoing project to do with our new curriculum. So we are revalidating our curriculum. And what we've done is, as part of the project team, is we have been attending all the meetings that is to do with new curriculum from start, and trying to document any conversations that has come up in relation to sustainability and planetary health. And if nothing has come up, which happens, then we have prompted the team to talk about these topics. I think the main outcomes from that first phase of the research project shows that actually our colleagues were much more interested and actually took initiatives to talk about these topics without our input, which we weren't sure would happen. So there's certainly an interest within our wider staff team to include this within their individual modules. So, for example, module leads in different modules throughout the curriculum. So that's been really useful. And we have now done a document analysis, which we talk about the importance of leadership and shared values. And then that's informed our kind of response to the team, which has meant that we have been promoting this particular theme to be embedded within the new curriculum. Now, the second part of this question was how to apply this type of research in clinical and community practice. I mean, that's a very big question. I think in general, action research is a good way of conducting research, because it means involving people, stakeholders within the design. So you don't do research on people, you do research with people. I mean, Flavian in particular spoke about practice partners, but also our Spanish colleagues spoke about, you know, healthcare settings and working with trusts. That's something that we definitely want to do more in Plymouth as well. So we are thinking about how we can reach out to our practice colleagues and try to work with them and students in practice as well. So I think it's a good design. How to do that in your particular setting is probably a bigger question. I'm not sure I can answer today, but I'd certainly be interesting to talk more about that if anyone wants to contact me or share ideas about their work. I hope that helps.
Thank you, Jenny. I don't think we have any other questions. So I'd just like to thank you all for your fantastic presentations. And it's been really lovely to see how you're all bringing together research and education, and particularly the involvement of students. So key points for me from this session is that a lot of it's about leadership, it's about collaboration, and student involvement, which is fantastic, and enthusiasm. And I see that you all have that wonderful enthusiasm. So thank you all again for your participation, and please hopefully enjoy some of the other sessions. Thank you.